Now, what is the function of the ligaments and what happens if we have injury? We're gonna start our talk by the MCL, the medial collateral ligament. First of all, where is the medial collateral ligament? The medial collateral ligament is actually medially between the tibia and femur. So what does it actually prevent? Okay, it's medially, so it's going to prevent the lateral rotation. Remember, because here we are preventing the valgus movement, because basically, guys, you are attaching the medial parts together. And I told you, if you are moving them away from each other, you are doing valgus. If you are moving them away from each other and doing valgus, you are laterally rotating the tibia. So the ligament that connects them together is preventing the valgus, and it's preventing the lateral rotation of tibia. Do you understand it now? All right, great. Now, remember that I told you the MCL is so much associated with the ACL. So what does that mean? It means, you guys know that I didn't mention it, but I will say it now, that the anterior cruciate ligament, the ACL, prevents anterior translation of tibia. I don't know how to draw it, but just try to imagine it. Anterior translation means if tibia comes forward. If this is your femur and this is your tibia, and anterior translation of tibia is prevented by ACL, anterior cruciate ligament. So the medial collateral is going also to prevent that, and it's going to prevent hyperextension of knee. You guys, most of the ligaments, if not all of them, they prevent hyperextension of knee joint. All right. Remember, MCL is always like the ACL, the anterior cruciate ligament. The medial collateral is following the anterior cruciate ligament, except for one thing. And the LCL is so similar to the PCL, the lateral collateral with the posterior cruciate. Okay? So now, you are medially. So you are preventing valgus and lateral rotation of tibia. Okay. Now, how will you do injury? If you are going to do what the ligament is going to prevent, you will do the injury. Like, what do you mean? I mean, if you are going to do a valgus force and lateral rotation of the tibia, because you guys, this ligament is trying to keep them together. So if you try to stress the ligament, if you are trying to stretch it over, you're going to injure it. So remember, if you do a movement that is going to stress on the ligament and stretches the ligament, overstretches the ligament, you are going to do the injury. Okay, so what kind of injury do we have for the MCL? It's very easy. It's basically what the MCL was trying to prevent, which is the lateral rotation of tibia and the valgus force. If someone hits that guy, valgus force, if there is lateral rotation of tibia, you are going to injure the medial collateral ligament. Now, what about the extended knee? If I have extended knee and I have someone pushing from here, you are pushing from this side. If you push from this side, you will have a valgus force that is going to make those bones away from each other. And if you are doing also lateral rotation, because remember, valgus with lateral rotation, you are going to rupture the medial collateral ligament. And flexed knee, you need to do lateral twisting of the knee joint. In your extended, a valgus force is more than enough to cause medial collateral ligaments injury. I hope this is simple now and easy. And if there is twisting, usually that involves the ACL. And if that happens, definitely you will have the unhappy triad, because always the MCL is associated with the meniscus. But if ACL is coming with them, we call it unhappy triad. Now, what happens to the lateral collateral? It's the opposite. It's the opposite. What does the lateral collateral ligament do? The lateral collateral ligament is going to prevent posterior translation of tibia, because it's just like the PCL, Remember, the posterior collateral ligament is a posterior. It prevents posterior translation of tibia. Okay, the medial collateral and ACL preventing anterior translation of tibia. LCL is always following the PCL. Now, how would you injure the lateral collateral? It's the opposite to the medial collateral. Medial collateral, remember, it was like that. We had a valgus force or lateral rotation of tibia. Here, the opposite. You will have a blow to the medial aspect, here. So you will do a varus force, or medial rotation of knee and flexed knee. Okay, guys? Now, we know that the injury is going to be opposite to the MCL. And now we understand what happens and we can imagine it. But you will tell me, why does the LCL do lateral rotation of tibia? Lateral rotation of tibia should be prevention of the MCL. Okay, this is something that I want you guys to memorize. It's not memorization, it has a reason. And the reason why, because the LCL is running below the iliotibial band in the same direction. And the direction of the iliotibial band is actually like the MCL. So the LCL will have the ability to prevent lateral rotation of tibia. Not only the MCL, also the LCL will have this ability. So please just add this to your notes. This is going to be just like the MCL. It prevents lateral rotation. And however, and it also prevents varus movement. It prevents posterior dislocation, and everyone prevents hyperextension. Remember that the injury is opposite to the MCL, but the rotation of the tibia that the LCL is preventing is actually like the MCL. Okay? I hope it's clear now. Now, what happens in the ACL and PCL? It's very easy that we understand that the ACL prevents anterior translation of tibia. It's very simple and easy because it's anterior cruciate. So it's holding the anterior part of the tibia from moving forward. And we understand that everything prevents hyperextension. Now, what does the ACL also prevent? It also prevents the medial rotation of tibia. How? You guys remember the movement, the running of the fibers of ACL? Remember the boy who was trying to throw the balloon? It was coming from the anterior intercondylar area and it was moving upwards, backward, and laterally. So if you are moving laterally, you are going to insert yourself into the lateral condyle of femur. If you are going to move and attach to the lateral condyle of femur, it means you are going to prevent medial rotation of tibia. If you guys look at the ACL, where is the ACL? Okay, if you guys look at the ACL here, anterior cruciate ligament, it goes from the anterior aspect all the way to the lateral condyle. You are going to the lateral condyle. So with that, if you attach yourself to the lateral condyle, you are going to prevent medial rotation of tibia. Holding the tibia this way, you are going to prevent the medial rotation of tibia. Okay? Now, coming back, because when you attach yourself to someone, you are preventing the opposite thing from going to the opposite direction. So the ACL is going to prevent medial rotation of tibia. Now, how will you have injury? Remember, the ACL is following the MCL, and everyone understands now what does the MCL do and how do we cause injury. With a valgus force, when we have a direct blow to the lateral aspect of my knee joint, valgus force, and fixed tibia, or if you have a lateral rotation of tibia, definitely. Okay, this is just like the MCL. Another thing, guys, if there is anterior translation of tibia, Remember that the ACL used to prevent anterior translation. So if you forcefully do anterior translation of tibia, it means you are overstretching the ligament. It means you are injuring the ligament. So remember, any ligament that is doing a function, preventing something, and you are doing the thing that the ligament is trying to prevent, you are overstressing the ligament and doing injury to the ligament. That will help you to remember the type of injury to ligaments. If you know the function of the ligament, what does it prevent, based on the course and the position of the ligament, you will understand that if you do what that ligament is preventing, you will do injury to it. And because the ACL prevents anterior translation of tibia, if you forcefully do anterior translation of tibia, you will have ACL injury. Other than that, the other way of injuring ACL will be exactly like the MCL. Valgus force, lateral rotation. L. This is medial collateral ligament and anterior cruciate ligament. How can you test for that? It's by Lachman's test. You will have a flexion of the knee joint 20 to 30 degrees. The physician will try to bring the tibia anteriorly, anterior drawer tests. You are trying to draw it anteriorly. If you can feel the tibia lags and coming easily anteriorly, it means the ACL is not doing its job. It's not preventing anterior translation of tibia. So it means a positive sign, and there is a lesion or injury in the ACL ligament. Okay? What about the PCL? Now the PCL